Okay, well, welcome everyone. You might notice that there is a little change in a few slides time. My hair will probably change, my outfit might change. That's just because we had a little bit of a technical issue when we were doing the recording of the original webinar. So I'm actually just here today just to redo a couple of the early slides so you don't miss out on some information. So yeah, apologies for that, but we'll make sure that you've got all the information you need. So I'm Dr. Caroline Allen. I'm a vet in the UK, and I'm currently writing a book on contextualised care, which has a very strong welfare focus. So I'm really delighted to be here today with Andrea, talking about something that I'm really passionate about, which is treating the patient, not just the pathology. I've also just started my own new business called Pet Lighthouse. And the focus of Pet Lighthouse is also very much this welfare-focused approach. It's a new service which helps support both pet owners and vets when you're in a tricky situation of owners maybe struggling to decide what is right for their pet, faced by lots of different options and struggling in what I call the decision fog. And Pet Lighthouse provides a second opinion service, very supportive, working alongside the vet, not instead of, to give the owner time and space to really work through what is important for them and their pet. So please have a look up at Pet Lighthouse. It's very much here to help and support. But yeah, so today we are talking about making sure that our work is really focused on animal welfare. Because, you know, I think this is really timely because I've been a vet for nearly 30 years and obviously I've seen a lot of changes, and many of those changes have been for the good. What is available in terms of the different tests that we can perform, different treatments that are available. I remember a time where if you had a dog with any kind of stiffness or arthritis, there was a big pot of pink tablets. And if you had a dog with chronic diarrhea, it was a big pot of yellow tablets. You know, things have moved on so much, but sometimes it feels like something's just a little bit been lost there, because we can do more than ever. But, you know, increasingly it can feel difficult to know what to do for the best. Families are struggling, and you know, the choices are so complex. And I talk about owners really finding themselves, and actually vets as well, in a decision fog. And you know, this is really borne out by data. You know, maybe something that we can all sense: increasing complaints, just a more general tension. But you know, we know from studies in the UK, but I don't think this is just a UK thing, but studies in the UK and the whole vet services investigation that we went through around competition and markets, that, you know, there is a little bit of a trust gap, people feeling that their pets might be over-treated, and owners actually avoiding the vet. And that's not good for any of us, and it's particularly not good for the animal. So on the original webinar, I did a bit of a Slido where I asked the attendees to sort of have a think about what they mean by the term animal welfare. I always feel slightly uncomfortable asking vets this, because it's like, you know, am I teaching you to suck eggs? It's a very English saying, but you know, it is. Of course, vets know about welfare, but actually, what's really interesting is, having spent 8 years as you know, very fortunate to be the chief vet of the RSPCA and work with really amazing welfare scientists, I actually realized that perhaps I didn't have as good an understanding of animal welfare as I could have done. I tended to equate welfare and health, and they're not the same thing. So it was really interesting to see what colleagues said. There was mention of health, treatment, but a broader, you know, view on that. And I think that looking after the pet and the owner is really important, because if you don't respect that human animal bond, you can get in all sorts of trouble. But yeah, I think terms like, you know, safety, protected, comfortable care are all really part of this. So that was really great to see. So, you know, one of the first kind of key takeaway points from this presentation is that we do need to always be challenging ourselves that welfare is more than health. You know, I think that as on the whole, we are really brilliant at the health, but sometimes perhaps not so good on the welfare. And that's, you know, something that I look back on and really see was probably the case when I was in general practice kind of 10 years ago. And particularly, you know, this in the orange here is the kind of oath that vets make in the UK. And it very explicitly says, you know, we're not just there for health, we are there for welfare. So we do need to be asking ourselves these questions all the time. So, you know, what is welfare? Of course, health is a really, really important part of that. But what we're going to talk about later in the webinar is actually we need to go beyond that, and we need to get comfortable talking about feelings. Animals are sentient. That is actually captured in law in lots of different countries, including in the UK. Animals have feelings too. So how do we really reflect those feelings that can be positive feelings of happiness, or negative feelings that can result in suffering? And importantly as well, you know, behavior is a really important part of this, kind of psychological fulfillment, an ability to perform the behaviors that come naturally for those animals, that we understand from their ethology, sort of what they would do in nature, if you like, what they enjoy. And also we'll come and talk a little bit more about the importance of agency or choice for animals. You know, they're really not so very different from us at all. So how we talk about animal welfare is something that is evolving. Animal welfare is a science. It is an evidence-based science, which is really good to know. And it is evolving as we get more knowledge. And many of you may have heard of the 5 freedoms. These were really important, you know, sort of around the they've been around many decades, and very important, getting us to start talking about animal welfare, to recognize that welfare is more than health. But the 5 freedoms were very much just about minimizing suffering. So it was kind of freedom from pain and suffering, you know, freedom from hunger. And that was really good. It was a really good starting point to try and avoid animals having negative experiences. But through taking that approach, we would only end up with animals having at best a neutral welfare state. There wasn't any scope within that model for us to recognize that, just like ourselves, animals would like to have positive experiences, to enjoy life and to have good welfare. And also, it was a little bit unrealistic, because we all will experience some negative feelings. You know, we need to feel a little bit of hunger before we eat. So the science has evolved from the 5 freedoms through to the 5 needs, and now we're going to get on to talk about the kind of preeminent welfare model, which is the 5 domains. And the 5 domains is an evolution of the 5 freedoms. We kind of went to the 5 freedoms, the 5 welfare needs, which are still enshrined in law, but the 5 domains is a build on that. It's been around for quite a few years now, and it is really the kind of internationally accepted framework that we sort of modern welfare science works within. And it is continually evolving. There was just a new paper out just, I think, yesterday about an evolution of the 5 domains into provisions of how you can provide for animals. So it's really, if you're interested, you know, there's a lot of really good literature. David Mellor and his team in New Zealand were the ones who came up with this. And yeah, it's definitely worth having a read of those papers. So just to go into that in a little bit more detail, there's 4 what are called, so there's 5 domains overall. 4 of them are what are called the functional inputs. And, you know, I think sometimes this language can be a little bit off-putting. It is a lot of common sense, I would say. So there are the 4 functional domains. So nutrition, so that's just obviously eating and drinking. Is there enough food? Is there enough water? Is there variety? Then there's environment. So, you know, is the environment comfortable? Is the temperature right? Is it too noisy? Is it, is it smelly? What's the environment like? Then obviously we do have health. Mustn't forget the health, but it is only one of them. And then we have what was called behavior, but has evolved into behavioral interactions. And that comprises 3 elements. That's how the animal is able to interact with their environment. So do they have access to go to places to rest? Do they have access to, appropriate toys and enrichment? Also behavioral interactions with other animals. So can they choose to interact with other animals if they want, but also avoid other animals if they want? And then with humans. So the interactions that they have with humans, are they, again, what the animal would like them to be? Are they positive? Is a positive training methods used? Or, are they fearful because they've, negative methods have been used? So those are the different behavioral interactions that we talk about. And so what you do is you kind of work within each domain, thinking about how the positive and negative within each domain. And then that sort of builds together to give you the overall mental state of the animal. And that's where these sort of feelings feed in. So it might be, a really good environment. You've got a lovely comfy bed, the temperature's right, that's great, but you're left all alone the whole time. And actually you're a very sociable dog and you would like to be, you'd like to be interacting with people. So you've got a positive here and negative here. And you sort of bring those together, and that will give you an overall sense of the mental state. So the integration. And so what you end up with in the mental state is an idea of ultimately how the animal is experiencing the world, how the animal is experiencing life, and how they're feeling. So I've already alluded to this. The 5 domains I think is a great model. It's really helped me develop my thinking. It is very centered on the animal and their experiences. And we'll come on to talk about that a bit more, because I think it's something we should, as vets, do a lot more. And that's, the title of the talk. We are so often like, this dog has heart disease. It's all about the heart. That's kind of how we're taught. It's quite natural how we fall into that. But actually, it's incredibly powerful when you start to think about the dog in their entirety, not just how they're feeling with their heart disease, but how everything fits around that. And actually, I had a dog who was very fearful of the vets because of previous experience. And so Tilly, she was a Staffy, she was kind of quite an inspiration, I think, for some of my work, because it did make me think, I couldn't just leave her at the vets or take her to the vets with something, because she just had such an awful time. So it was always having to think about that balance of experiences for her. Yes, there's long-term benefit, short-term distress. How do we balance those things out? So this does throw up a lot of ethical questions, which we'll probably come on to. But yeah, I've already said it alludes to the continuum of animal welfare. It is the way it's used, it can be dynamic in nature. We, animals and ourselves, cannot be happy all of the time. That's just a fact. If we didn't feel hunger, we wouldn't eat and we would fade away. So we're not talking about the sort of utopia of a kind of perfect experiences all the time, but we are talking about how we maximize the positives, we minimize the negatives over as long a period as we can. So it's sort of got that pragmatic, and yeah, it's inclusive of positive experiences, which is so important. So we've got these 4 domains. And so what do we do with them? Basically, and to some extent, it is a bit of a mindset shift. There's not a long list of questions to ask. I mean, I have written a long list of questions to ask, but that's not necessarily, I didn't want to just put up a long list of questions for you to ask, because a 5 domains mindset is really what we're working towards, whereas we don't just think about health, we've just got those other kind of things in our mind. But the approach, if you're going to do a full welfare assessment, is certainly to start to think about within the domains each of the conditions and think about whether for the animal they're likely to be feeling good or bad. So I'll come on to talk about that with a little example. The really important thing is that this has to be done with an understanding of the species, which you guys will have. And we use the term, which I really like when we're thinking about animals and their feelings, we use the term critical anthropomorphism. So anthropomorphism, as you'll know, is a kind of attribution of the human feelings to animals. So just trying to think of an example. I like to be with my friends. So, of course, my cat wants friends. But your cat's actually not a social cat. They don't want friends. They don't want you to get them a sister. That's not what they want, because they are predominantly solitary species. So that would be anthropomorphizing. It's like my cat's not happy, they're bored, they want a friend. Critical anthropomorphism is allowing ourselves to attribute feelings to animals and understanding that as we are all mammals, as we all have a lot of the same neurobiology, they will have a lot of the same feelings as us, but we use our knowledge of the species, their behavior, their ethology, to make sure that that attribution is as accurate as it can be. So what we know about cats as predominantly solitary species, we would look at the behavior of the individual. We would see whether those cats are allo grooming each other, lying together, or whether they're just like really trying to avoid each other on the end of the bed. And that would help us. So we would probably say, look, what I would say, your cat has been living their life quite happily. You think they're a bit bored. I suggest that you get some toys for them rather than getting a sister, because my knowledge of felines is that is probably more appropriate. So this allows us to start to ascribe feelings to animals, and we do already. We talk about pain. Pain is a feeling. We talk about pain. Pain is really important. We should be more open to discussing other feelings that animals have. So, and thinking about them. So that could, fear, frustration, being too cold, being too hot. There's so many, but we just have to open our mind up to actually be thinking, how is this animal likely to be feeling in this situation? How would I be feeling in this situation? Oh, there's a question popped up. So anthropomorphism, how do we think the animal feels, like based on what we know about them? And that can be them as a species, but also them as an individual. So I knew, Tilly, the experiences that she'd had in her life. I did know the things that were likely to make her fearful. I also could pretty much read her body language, but I was able to read that in a way that probably someone who didn't really know behavior very well and didn't know Tilly, they wouldn't have necessarily been able to do that. So feelings and emotions, that's a good question. I don't think so. I think the key with this is not to get too hung up on terminology. There is a whole massive, and even, I'm not a welfare scientist, but I have been working with a welfare scientist on the book I'll talk about. Provisions, domains, affective states, welfare indicators. It's quite confusing, but even like this Kat Littlehood, who I've been working with, who's one of the people who work with David Miller on the 5 domains, she's like, you don't need to worry about that. What you need is to think about how this applies to your practice in a practical way, which we're going to come on to. So this is just to give an example. Environment, quite straightforward. How would you feel if you were in that nice, cozy, comfy bed? It's not loud. You've had a lovely walk. It's a nice day, and you're in that lovely, comfy bed. Versus, you haven't got a bed. You're on this horrible, dirty floor. You're not able to have choice about your movement. How would you feel? And then, yes, we know, what dogs like and don't like, and you know, it isn't rocket science, some of this, but we need to call it out because we haven't always been in the past. And so then as we kind of work through each of these domains, thinking about the positives and negatives, and we can do that in our head, we can do it on paper, and it comes together into the welfare state, that essentially leads us to an idea of quality of life welfare. You know, there are subtle differences, but they can be used interchangeably, is my view. And we start to think about the balance of feelings. And I think this is so powerful because if we've got an animal that isn't doing so well, maybe the you know, they're getting older, they're getting stiffer. You know, obviously you're doing the health side of things, but it enables us to think about what are the other positive experiences that we can introduce to this animal's life, because we want to be maximizing the positive feelings and minimizing the negative. And when we do that, they move up this chart. So, you know, if an animal has just overwhelming negative feelings, then they have a life not worth living. And we really need to be thinking about, can we improve this? And if not, we should be euthanizing this animal. Good question in the chat. If they prefer sleeping on the floor, then, you know, that is their choice, and that's their individuality. And so it is important to kind of understand the individual. But it would be about, in that situation, it would be about their agency or their choice. They have a bed, they choose to sleep on the floor. For those in the UK, you know, it's really hot at the moment. My dog is choosing to sleep on the floor, but she also has a lovely bed. So I think we will start to talk much more about agency and choice in animal welfare. It's so important. So yeah, so this is really important. We want to be thinking about how we can move animals up this chart. And, you know, if we can't, then, you know, below the neutral line, you know, a life worth avoiding or a life not worth living, those are not states that we want our patients to be in. And they certainly shouldn't be in them for any length of time. And, you know, when the negatives are really overwhelming the positives, or when you've got some really strong negatives like pain, itching, breathlessness, you know, you would say that's a life not worth living, you do need to be starting to, well, you need to have already ideally had that euthanasia chat, or maybe that might come up in the questions. So the good point, the important point here is that we are not suggesting that every vet is doing a full welfare assessment in their consult room, because that is not possible. You're not welfare scientists. It is about a mindset. It is about thinking about the questions that you're asking already that can start to give you an idea about how the animal's feeling, about their welfare, about some of these conditions. There might be some questions that you might want to think about adding in particular circumstances. But it is very much thinking about what is the information that I can pull from what I've already got. You know, there's a lot that you can tell with, you know, when a pet comes in the door through their behavior, but obviously that's only their behavior in the clinic. So you might start to see quite a lot there that was actually a little bit concerning. You know, they don't want to be here. But actually, what is their life like at home? Obviously, with technology now, the use of videos can be incredibly helpful. Owners videoing things at home, you know, an idea of the environment. I think that can be particularly important for cats, you know, who've maybe got things like urinary tract issues, which we know have a behavioural component to them. So just thinking about that. I think if someone asking a very good question about reptiles, let's try and park that one for afterwards, because I think it's a really good question. My views may be slightly controversial, but we will maybe not here. But yeah, and then obviously your clinical examination is also telling you a lot about animal welfare. You know, it's not just an illness or a broken leg. It's the feeling that's associated with that. As I say, we're really good when that comes to pain, but actually we're not always so good maybe when it comes to skin conditions. Itching is horrible, you know, and if we think about how the animal is feeling, you know, I have eczema, so I know itching is horrible, and that feeling for that animal is going to be very aversive. So when we are dealing with skin disease, we obviously want to deal with the underlying condition, want to treat it, but thinking about what's the quickest thing to stop that itch safely is actually really important before you might launch into your differentials. And so, yeah, so we've all been really well trained to have, the differentials, problem list, diagnostic treatment pathway. And so that can create a very efficient pipeline, which I think, we like, we're quite comfortable with it. And that's, that's great. But as I said at the beginning, not everyone's like super happy with that, and we need to be able to find a way to flex and to understand more about what the owner and what the animal want to achieve out of our consultations. And the owner, they can tell us, they have a voice, they can verbalize. That might be in the consultation, it might be through a complaint or a Facebook comment, or our owners, they can talk to us. They often won't, which is kind of interesting, but they can. The animal can't talk to us verbally. They can't verbalize what they want, but the 5 domains allows us to bring their voice to life. If we do it well, we should be starting to think, how is this animal feeling about the situation that they're in, and what would they want me to do about it? Does that kind of make sense? Yeah, I mean, there's a good point here. I think most vets do undertake welfare assessments. Yeah, I think they do. I think a lot of them are more health assessments. Certainly for some vets, I know there is really great vets out there who are doing, this 5 domains approach in their head all the time. But yeah, it is difficult when there isn't enough time. I think it's then thinking about, how you maybe think about, is there information that the owner can collect in a pre-questionnaire? What's the role of the receptionist, the nurse, the care assistant? Because this stuff can't all be done in 10, 15 minutes. But if you've got that mindset as a starting place, I think it will hold you in good stead. So where does this sort of take us? It's welfare science. It's the thought that welfare is the animal's own experience of their life. It isn't just the absence of disease. And while, of course, we really want to focus on the absence of disease and want our patients to be as well as possible, we always need to bear in mind, what is their wider welfare? What is that animal experiencing at that time? Because just because they're healthy, it doesn't actually mean that they've got good welfare. So, an anxious dog kennelled all day while the owner's maybe on their Zoom call or whatever, downstairs, bark, 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 probably overall welfare maybe not good. They're anxious, they're not exercised, they might have loads of food, but it's just put in there and they just wolf it all down, no enrichment. But actually, a cat, for example, in kind of in stable chronic renal failure, well treated, not actually suffering from any nausea at that time. I sometimes say this to my clients when their pet has a serious condition like cancer. The good thing is your pet doesn't know they've got cancer. So it's incredibly distressing for you. But actually, as long as we are able to treat the disease to the best that we can, minimize the side effects so they don't actually feel lethargic, nauseous, any of these other things, they don't actually know. And that's another place where this kind of feelings framing can come in, that actually, although sometimes we worry that owners will maybe say, oh, the vet's talking about feelings, are they not proper scientists? Owners actually love it because they know their pets have feelings. So, yeah, I think there's almost sort of, it's a bit of a win-win, really. So, so this leads us on to talk about contextualized care. How many of you have kind of heard the term contextualized care? Do you want to put a thumbs up? It is a bit of a buzzword, but I don't know how far it's kind of gone. Yeah, so a few hands. Yeah. So basically, contextualized care is a little bit of a challenge to what was called the gold standard, which I really hate because it isn't and it's not evidence-based, but the kind of hyper-technical, process protocol driven, in that we take a step back and we look at the contexts, that the context of the owner, the context of the animal, and the context of the clinic and society more broadly, to help us come up with a plan of what we're going to do. And the 5 domains give us a really nice model because we can start to hear about the animal's experiences and what they'd actually want us to do to make them feel better, to push us up towards more positive feelings. We start to talk more to the owner about what matters to them and what their real constraints are, and we try to work towards a shared pathway. So there's not the history is very similar. There are some slightly different questions that can be asked, just a little bit more open, and asking, you can ask about feelings and things like, what does a good day look like? What does a bad day look like? What maybe things have the pets stopped doing? Maybe what were the things that they used to really enjoy that they now can't do or they're not doing? So it's well worth having a think about some of those questions. Could you slightly address those? Delving a little bit into the history from an owner's perspective. But then the problem list, what I think is really helpful is letting your problem list develop a 5 domains approach. So rather than just like PUPD, you might also put anxious, bored with diet, not enjoying food, bored with their food, not enjoying their food. That is actually really relevant. I think we can dismiss, well, no, just continue with the renal food. They've got to eat it. But actually, if they really hate it and, they're miserable and the owner's stressed, is there things that you can do with other food and putting some phosphate binders in, and, an honest conversation with the owner about, what is more important to you, quality of life or quantity? Most owners actually do say quality. So anyway, now this is still work in progress. I'm in the process of doing some work with our CVS knowledge and writing a book, which will hopefully provide more of a discussion framework to do a sort of easy mapping of this. But it's certainly something, again, I'm sure you're always doing it in your head anyway. Having a check back in with the client and then working towards a sort of shared decision. It can take a little bit longer, certainly, but this is where you can think about how you use other measures. Contextualized, I've heard this a lot. Contextualized care is what we've always done. I would say, I'm an old school vet as well, but I think that it has got a bit lost in this kind of protocol driven. Like, you do not see contextualized care discussed in any of our journals, except in Companion, because me and Ian Futter wrote some articles on it. So it has been lost. But the fact is, we didn't have MRIs back then. We do have them now. How do we navigate what is now a new? It is a different world to when we had contextualized care in the past. So we do need to find a new way of doing it, I think. So, just conscious of time. So we're going from presenting options. So, and I do know that this is a trap that you can fall into, which is like, right, this is the textbook thing that we should be doing, but well, you can't afford that. So, well, we could do this, and we feel uncomfortable with that. The owner feels judged. It all gets a bit uncomfortable. We end up often just focusing on health alone, to a contextualized approach where actually the starting point is what matters to the animal and the owner. And that different starting point, I think, creates a more positive discussion, even if there are, and the limitations, the context, finance is just one part of it, actually. I had this really wealthy couple who it was really important to them that they went and saw their football team, traveled all around the world, and then their cat got diabetes. That was a really big deal for them. So, that taught me a lot as well. about, don't judge. You need to have a way of understanding what's going on in people's lives, because they were like, oh my god, my cat's got diabetes, we can't cope with this, you're going to have to put the cat to sleep. And actually we managed to work through it, and we took a fairly, some days the cat didn't get its insulin if that was difficult for them to get someone to go in, and you know what, the cat did absolutely fine for years. But they had to accept a degree of risk with that. So yeah, it is about, it could be the same diagnosis, but with a different family, different animal, there is going to be a different right answer. We've got to get comfortable with there not being one way to do things. And, you've got your protocol, that's fine. That is there, but it is not the same as the plan. So I've already sort of alluded to this, and, this already, the different contexts that the owners have got, which finance is just one. There's the practicalities, there's values, and there's emotions. And then we've talked about the animal voice, their welfare baseline, but also what welfare compromise are we putting them through in this plan? Are we sure we can justify this for this particular animal? And I think that's where I think we need to have a lot more discussion. Some of the things that are being done, advanced procedures, I'm not comfortable with them all, and I think we need to have a lot more debate about that. So we talked a little bit already about what are the history questions that you can add to the history, which just gives a little bit more space for some of these things to come out. What do good days or bad days look like? What's the hardest part of caring for them? And, if we stopped, well, this is probably more when we're getting into some of that advanced, what would your worry be? So second sort of takeaway point after the welfare is more than health is just because you can doesn't mean you should. And we should always be having that welfare check-in. So I'm going to do a quick case study, then we'll sort of wrap up. So Beryl, and this case study, like the ones in the book is going to come out, are all based on real life. It's that Friday afternoon pio. Vulval discharge, drinking more. She's rushed in. Maybe you're the clinical director, and the vet's like, oh, we've got a Friday afternoon pio, but Beryl's kind of coming. She's really overweight. She's sort of coming quite sort of stiff, and she's got a lot of tartar on her teeth. So I'm just interested in the questions that you would ask to understand Beryl's welfare. If you can't get on the Slido, feel free to pop them in the chat. Or just any salient points about Beryl's welfare. Anyone? Oh, I've got one. Yep, so what's a normal day like for her? Actually, a normal day is she sleeps most of the day. She used to really like her walks, but they're a struggle for her now. Yeah, her diet, she really loves her food. She's on a dry food. She just goes for it. And yeah, she loves her treats. How does she like her walks? Yeah, she kind of struggles with those now. They're not great. She's panting a lot. So we don't take her out very much. So yeah, this is good. Like, what's her favorite activity? What does she like to do? I don't think they're always questions that we would ask, but I think they're questions that we should ask. Yeah, so, is she groomed? Does she enjoy it? So the owners have limited funds. They can take out a loan to afford the surgery if it will save her, but it will be hard for her. They're really devoted. They're really lovely. I'm going to put you on the spot. What would you say to them? Can you save her? Do you want to save her? I think the slider is a bit slow, isn't it? I mean, while you're typing, I'll just give my perspective for a bit short on time. I think when I was in practice, and including at the RSPCA hospitals, the Friday afternoon PIO, it would be, oh my God, it's a PIO, let's get in, let's do the PIO. We'll do the PIO surgery. Yeah, of course we can save her. We can do the PIO surgery. Yeah, we can try, let's try and reduce the fees for you. Let's, that whoever's written that's such a brilliant point that's just gone in. Would you be happy to have her go back to what she was like before? But I think I would even put, is she happy? She has severe arthritis. She doesn't go out for walks anymore. She's got periodontal disease, which she's probably got some tooth pain. We know what tooth pain is like. So, I think that the question is, we can do this surgery, but really, you're going to need to absolutely commit to get the weight off her. Is that realistic? We're going to need to sort out some medication for her arthritis because she's in a lot of pain and she's going to need a dental. Are those things that you can realistically commit to? Because if you just do the PIO, you're doing half a job. We're not really addressing those feelings, which is probably pain, lethargy, pain in the joints. So, and then I'm not saying, well, no, we'd have to euthanize her, she's got a terrible life. But we have to have that conversation with the owner in a very empathetic and a very kind way. But just rushing into the PIO, yes, we can save her, it isn't the welfare-focused approach. And, I think it's really kind to reduce some fees. But if I was going to be reducing fees on a case, I would be choosing a case where, you're going to get a really good welfare outcome at the end of it, which arguably with this, you're going to fix the health problem, but you're not getting a good welfare outcome. So I throw this, these are not easy. Yeah, we need to think about how she's feeling now and make steps towards fixing it. But do they think that they're actually going to be able to do that? I think it would be hard for her. But yeah, back in the day, I would have just do the PIO. We'll worry about the other stuff after. But if you haven't spoken about it with the owner, you're not being completely honest with them. So we're a bit short on time, so I'm going to run through quite quickly now. So this is that kind of kidney cat, probably got early kidney disease. Oh, it says dog, not cat. But again, with dental disease. And I think sometimes, when we've got a patient, an older patient, lost some weight, drinking more, we sort of put the teeth to one side. Whereas, resorptive lesions are really painful. And if we think about the feeling, that will sort of focus us on, really what is important to that animal. And just very quickly, just to end, we do need to think about the owners and their feelings. We do worry about the impact of euthanasia, of course, but there are impacts if we avoid those conversations. Caregiver burden is a recognized condition, psychiatric condition, which can, be related to depression and it is significant. So we can't ignore that. So, just things that you might see with the owner, difficulty making decisions. That's a really interesting one. Tension between families, obviously being emotional. And in the UK, if you are potentially heading towards that euthanasia situation, we've got the Blue Cross Pet Loss Support line, which is brilliant. And they will absolutely have conversations before the end, so they can help owners in that. But it's well worth understanding the issues of caregiver burden and anticipatory grief, because they will impact the behaviors of your clients. And so some of those difficult emotional clients might actually be dealing with these feelings. So yeah, I'm going to just whiz through because I want a bit of time for questions. But yeah, creating that space to have the conversation, recognizing that this is really hard. There isn't a neat protocol, I'm afraid, that's going to fix all these things. We do have to live with complexity. And yeah, just the takeaways is, the two that we've covered, and about thinking about contextualized approaches, which has to include the feelings of the people involved. And final point, for those of you in the UK, my new business is called Pet Lighthouse. It's an online second opinion service that creates the space for clients who are struggling with these kind of complex decisions, who want time to have a more comprehensive welfare assessment of their pet to help them decide if they have got to make decisions about treatments or end of life decisions as well. So that's Pet Lighthouse. So yeah, any questions?
Beautiful. So wonderful. I love this. I think it was so amazing. And it's what you were saying. It's you don't have to change anything. This is just your perspective changing. And I don't know, I just see how tomorrow this is going to be completely different when I go back to the clinic. Which is, I hope, good news. Um, we didn't have a lot of questions because we were also answering them as we
Yeah.
went. However, there was that question about the exotics.
Yeah. So I'm not a reptile vet. I will say that. But obviously we did do some work with reptiles at the RSPCA, and I think there's a lot of controversy about this, but I think that I am really a fan of the idea of positive lists. So the starting point of that is that there is only a relatively small number of types of reptile or types of exotic species that can be kept as a pet. I mean, I even wonder then. But yeah, if we take it back to the 5 domains and we look at what they need from an environmental perspective, how they feel about their environment, if we think about sort of behaviorally, their kind of natural ethology and naturally how they would behave, I think it is incredibly hard to provide for those things in a captive environment. I also think we've got massive issues because we just find it much harder to speak their language. We
Mhm.
just, it's so, there is not the evidence there that we have for the dogs and cats. So I think that they can often be kind of silently suffering. I think there's a lot of work that you have to do to hear the voice of those animals and then be able to meet their needs. So I'm not generally a fan of exotic pets. I don't know, and I could be certainly open for criticism because I don't know enough about it. But I think we need to kind of probably have the precautionary principle that what we know about these pets and their needs, it's really difficult to meet them.
Yeah. Uh, let's see. I think that's something that really needs consideration as well. I actually think we, again, because we were discussing things throughout the presentation, I think we don't have a lot of questions. I know also that you're a bit pressed on time for this, so we're going to finish right on time at 8:30. But just so everyone knows as well, Caroline has left her email. So if you guys have any questions or anything you want to discuss on this field, you can get in touch. I hope I can say this. They can get in touch with both
Yeah,
of us,
yeah, yeah. And I think,
either or.
I am really interested in sort of thoughts and feedback as well, because
Mhm,
this is the term contextualized care is still new. Like, we did some work on it, me and the other charity chief vets, before the pandemic. We were
mhm,
calling it more pragmatic care. Then the vet humanities came along with contextualized care. So yeah, while we have been in many ways practicing it, some of us have been practicing it for decades. It didn't have a
yeah.
name. It sort of lost its way, this kind of gold standard, which I hate the term because it isn't gold standard. The evidence is not there for it, but it sort of took over. And so, and the world changed. So it is how we navigate our way through this. So many options, so many choices. How do we actually navigate that? It's really
Mhm,
comforting if you're just like, well, I have to do this and this and this and this and this, but it isn't working.
mhm.
So but the framework, some of the things, the science isn't new, but some of the frameworks we are developing, and I'll have a book out later in the year, Wiley book on contextualized care.
Yeah.
So I'm really interested in thoughts and feedback. So it's
Mhm.
feeding in, and it's going to be very kind of case study led. So yeah, you may notice Beryl down the line because I think it's
Yeah.
such an interesting case. We would all we would all run, and we would Friday afternoon. You just do the PIO, but
Mhm.
actually
No.
you've spent thousands of pounds of someone's money and you've given them back a dog which is alive, but
Yeah.
their welfare is not good.
Yeah.
They
I think.
life worth living.
I think a lot of it's what you're saying. A lot of us do it without realizing that we're doing, it, especially where we don't have the time constraints. Like my consultations can be 1 hour long if they need to be. So we have the time to go through that and really discuss things with people and understand their point of view as well as the pets' uh, lifestyle, really. So
Mm.
and I think. when there is a framework for our scientific brains, it helps us follow
Yeah.
through. So I think it will be
One,
really, really good.
maybe one final point as well, though, is that you
Hmm.
can't just launch this new way of thinking on owners at crisis point. You know,
Hmm.
it is a bit about, it has to be the ethos of the practice.
Yeah,
And so when they come in for the puppy consult, you're talking a bit about behavior and nutrition, and the nurses are really on board with it, and you're talking about feelings and quality of life early on.
yeah,
Obviously, you're going to have to gradually introduce that, but yeah, if you've been absolutely medical and then suddenly you're like getting to end of life and you bring up euthanasia and talk of quality of life, then that could potentially cause a problem. Although I think
yeah.
we should talk about euthanasia more, much earlier. It is, for me, it is the most important welfare tool. All our patients are going to die at some point. That's the one guarantee thing we have. So how do we make sure that they have as good a life for as long as possible, and then they have a good death? And I
Yeah.
think that means that we talk about quality of life from the beginning, and we keep those conversations going.
Wonderful. I think this is us, guys. This was amazing, Caroline.
Thank you.
I
Great.
will speak to you after because I really want to
Yeah.
hear more about this and read the book. For everyone else, I'm leaving the email for your certificates of participation, so you can email us at info at univetsglobal.com, and we will send you your certificates. If anyone is from the UK and you want it for your one CPD app, let me know, and I'll send you as well the QR code so you can use that directly and have it all put there. I will let you know about the recording. Unfortunately, I realized the recording wasn't on from the beginning, so we started on the five freedoms basically.
Okay, not to
But
worry.
I
Yeah.
will I will add a little extra on the text that goes with the video. I'll let you have a look at that, Caroline, and hopefully everything will make sense to everyone. Thank you for this. It was lovely. It was really energizing for me anyway. Um, I hope you guys also enjoyed it. I want to thank you, Caroline, one more time for joining us
No,
as
thank you
well.
for having me. Really enjoyed it. So take
And
care, everyone. Have a good evening.
exactly. And we'll see you in the next one.
Great. Bye then.
Bye,
Thank you.
everyone.
Bye.